Director of the Oregon Office of Emergency Management. Happy to be here today to chat with you all and answer some questions, and we'll be joined by a very special guest who I'll introduce in just a bit. Before we get started, I want to clarify the frequency of these conversations. I want to acknowledge and appreciate your understanding yesterday, a very busy day, and I wasn't able to come and meet with you in this virtual environment. All of us are working incredibly hard to manage the situation. And there's going to be some days as we continue to progress where I'm just not going to have time to be available for these conversations. But when I am, there will be a media advisory sent out on those days. So make sure you keep checking your inboxes, spam folders, or wherever some of these notices might end up. We want to make sure that you're able to tune in and get some of the information you need and get your questions answered. Even if I'm unavailable, I want to recommend and remind that you can always reach the Joint Information Center for any and all questions you may have regarding the state's response to this outbreak. So today, before we introduce our guests, I want to talk about flattening the curve. When we stay home, we limit contact with sick people. And if we have been exposed, we limit passing the disease and the germs to our friends, family, and people that we may never meet. Some of those people we may accidentally spread it to are the doctors, nurses, and other frontline critical workers in our communities. By limiting contact, we also protect our first responders and frontline workers, as well as preserve hospital capacity by only going out when it's absolutely necessary. And we extend the life of our state stockpile of personal protective equipment, or PPE, by limiting the spread of the virus and the need for that PPE to be used. The accessibility and availability of our PPE remains a critical component of our response. We want to make sure that that's part of what we're communicating about slowing the spread, staying at home, and lowering the curve. Now, one of the things that has been apparent to me throughout my career and is reinforced on a daily basis, emergency managers don't know everything. But it's important that we have the phone numbers and the contacts and are surrounded by the people that do know everything. For today's conversation, one of those smart people is Dr. Dean Sidelinger from the Oregon Health Authority. Today, he's going to do a deep dive into modeling or the projections of how this disease is spreading in Oregon. Dr. Sidelinger is going to show us how the model is being applied here in the state and leading to some of our continued recommendations to stay home and save lives. Before joining us as Oregon's public health officer, Dr. Sidelinger was the public health officer for San Diego County, specializing in epidemiology and immunization and health preparedness and response. Thanks to Dr. Dean Sidelinger for joining us today from the Oregon Health Authority. Dr. Dean, do we have you? Dr. Sidelinger, are you there? And can you hear us? All right, we're working on some connectivity to Dr. Sidelinger.
So, Andrew, I think you have me now. Is that correct?
There we go. Awesome. And you're right over here? Split screen? Is that working? Or do I look really goofy, even more so than usual? Awesome.
No, I think in there, no, where you're that way. That way.
This way.
This way. For me. The other way for you.
Perfect.
I'll get it worked out, Andrew.
You know what? I'm just going to look at the camera and not worry about where you're oriented on our screen. Thanks for joining us. You've really been busy throughout this response and even before COVID-19 came into Oregon and came to the U.S. with monitoring and seeing how this disease was progressing overseas. What can you tell us initially about what the modeling is showing us about the governor's Stay Home, Save Lives directive?
Well, I think what we're seeing is, as we look at the cases here in Oregon, they're reported to us from laboratories and clinicians across the state. But we want to be able to look forward to help with planning so that your team in Salem, our team as a state, our healthcare partners, that we can work together to try and anticipate what's needed, not just tomorrow, but weeks down the road. So we've been working with researchers and modelers from across the state and reached out to people all over the country, actually, on people who are doing this work. The Institutes for Disease Modeling in Washington State has done a lot of similar work for the state of Washington and King County and agreed to help us with this data. So what we do is on a regular basis, we give the modelers in Washington information on the cases in Oregon. When are they presenting? How many tested positive, tested negative, who's hospitalized? And they use this information along with what we know about the disease, how contagious it is, how long people are sick, when they're contagious, when they're sick. And they try to estimate how many people a sick person would come into contact with and how many people might become sick based on those contacts. With that information, they can look at what the governor has issued in her executive orders about closing schools, closing restaurants, closing other businesses, and requiring only essential workers go to work. And they can tell us what it may look like over the next weeks here in Oregon. We use this data not to predict the future, because none of us can do that, but to say what is the likelihood of something happening in the weeks coming up, and use that for planning purposes. So we can work with our healthcare providers and ensure that we are have capacity in our hospitals to care for them. And what we are encouraged for in the latest update on the models that came to us from our partners in Washington State is that it appears that we will not see a dramatic spike in cases over the next month here in Oregon, that the cases will rise slowly and rise slow enough that our hospital systems should be able to care for the people who get sick, should be able to provide the critical care for those who are most sick, and that Oregonians can have access to high quality care. This model is those results are dependent on a few things. It's dependent on all of us heeding the governor's recommendations and the governor's orders to stay home to save lives. It's dependent on us having personal protective equipment for our healthcare providers so that they are safe at work and not becoming sick. And if we can accomplish those things, we are cautiously optimistic that here in Oregon, the cases seem to be rising at a level that we'll be able to care for the people who need it most.
Dr. Sidelinger, I think that's an important distinction to make, that this is not about predicting the future, but it's about identifying trends based on the most current data and the information we have, which continues to drive decisions both at the Oregon Health Authority and then enterprise-wide across the state, how we're working to prepare for and continue to respond to this outbreak. So I appreciate that clarification. We've heard in the news that some states are just now implementing the same measures that we've had in place now for a couple of weeks. How can we talk about maintaining the posture that we have right now with staying home and saving lives, only going out for essential trips, minimizing contact, social distancing, all those things that, quite frankly, after a couple of weeks are becoming a little bit more normalized somehow, but still leading to uncomfortableness. People want to get back to their routine, and I think we're looking for any indication that we can start doing that. What I'm hearing is now is not the time to take our foot off the brake and to go back to business as usual or how it was back in February. What are some of the things that we can do as Oregonians to maintain this momentum and ensure that curve that we're trying to flatten stays flat as we work to get through the rest of this outbreak?
Well, let me first say that I know the measures that we've taken here in Oregon that folks in other states have taken, come with a tremendous cost. We know that the impact on the economy is great, from the impact on our small and large businesses, people getting laid off and not getting paychecks. Not to mention folks who are at home and feeling isolated from their friends, family, and support system. That last one, I encourage people that just because we're staying home to save lives and we may be alone or with a small group in our homes, that doesn't mean we shouldn't be reaching out to our friends and family, using electronic means, our phones, video chat, and other things to stay connected, to keep some of those social relationships up, which are very important. Many people are able to work from home, which brings new challenges and new opportunities. Bring your son or daughter to work day is kind of an everyday thing for a lot of people now, and we see a lot of appearances by children in our video calls and virtual meetings that we've been having. But what we know is that these things appear to be making a difference. When we look at some monitors of whether people are going outside, like traffic from Oregon Department of Transportation or from some of our cities, it shows that traffic on our roads is down significantly. We know that visits to emergency departments are down. And so we hope that people are staying home and not coming into the emergency departments with minor symptoms that could be cared for at home or via a televisit with their doctor. But we know that it takes some time for these interventions to have effect, and that the cases, which the Oregon Health Authority is reporting this week, were likely infected 3 weeks ago. So these measures need to be in place over time so to prevent sick people from being exposed to people who've not yet had this virus and to keep them healthy. Because someone who is sick may expose someone. That person may develop symptoms a week later. They may have mild symptoms and not seek care for several days. Then when they seek care, if they're sick enough or meet one of the high-risk categories, they may get a test, and those results may come back in a few weeks. So what we're starting to see now in the models is really what is indicative of what was happening 2 or 3 weeks ago. And we know that over time, we need to have these measures in place to keep people at home, to keep sick people from coming into contact with others and making them sick. And this isn't a 2-week sprint. This is a longer, weeks-long or months-long kind of marathon. And so we know it's tough. We want people to take care of their health while they're home, trying to eat healthy, still get some exercise, even if that means running around your bedroom instead of going to the gym. And again, reaching out to friends and family and keeping those social connections alive using our phones and computers and other means, I think are all ways that we can keep people supported in their homes. If you have an elderly relative or someone who can't get out and get their essential needs met, the food they need and the medicines they need, by all means, reach out to those friends, reach out to those relatives so you can help them out and ensure they're getting what they need in a safe way.
Yeah, I'm glad you emphasized sort of the social connection. I think we want to make sure that social distancing doesn't always equate to social disconnection, that we're still finding ways to connect with people, whether it's our immediate circle, folks that we may work with, and using technology to bridge some of those physical barriers that we have now with the Stay Home, Save Lives order. I also want to just key in on something you said as well. Some of the things that we can do to stay connected, using social media, picking up the phone and actually making a phone call on those devices that we use for social media. Those become really important. But we want to balance that, I think, right, with some of the onslaught of information and some pretty scary images that we're seeing on social media that are happening not just here in Oregon, but other parts of the country. And I want to take this time, too, to acknowledge our media partners who are doing a really good job of sharing the information we want them to know to be able to make decisions to protect themselves and their families, but also interspersing different content to kind of break up some of this news of COVID-19 and some of the more serious consequences of what we're trying to fight here. So I really appreciate that. So we're seeing much more testing, I think, throughout the state, throughout the nation. We've been seeing a pretty steady increase for the most part since we began testing. Wow, over a month ago, I think. What can you say about sort of whether or not it's a lack of testing or not enough testing versus the social distancing measures that are kind of driving what that curve looks like and what those models are telling us?
I think what the models take into account is that the tests that we report, the negative tests and the positive tests, are just the tip of the iceberg. We know for every person out there who tests positive for COVID-19, there are many other individuals who likely have the infection, but haven't sought care and are staying home while they recover. The vast majority of people, 80 to 85% of people who get COVID-19 are going to recover without ever actually needing to seek care. And so that's what we encourage them to do, to stay home while they recover. Certain segments of the population, children and adults with underlying health conditions like lung disease or heart disease or diabetes, and older adults over 60 are more likely to have complications. So if they start developing symptoms of COVID-19, fever, cough, shortness of breath, they should reach out to their doctor or healthcare provider earlier to say, when should I seek care? When should we follow up? What signs should I look for? because we want people to seek care when they need it, but for those who don't need care, we want them to stay home so that our healthcare providers, our healthcare systems can take care of those who need it the most. So our modeling does kind of take into account that only a subset of folks are being tested, and we know that's the case across the country. That as testing becomes more available, we will do additional testing, but for now we know that not everyone who's sick gets a test for COVID-19, and that's okay. You know, that they can stay home and recover before they come back to work. And we can save the tests that are available for those most at high risk, the folks in congregate care settings, you know, in nursing homes and jails and other settings, our healthcare workers, our great first responders who are out there responding to 911 calls and bringing people in for care, and other populations who are highest risk for complications. We can do those tests, and as the tests become more available, additional people may also get those tests.
So one of the things that I know is being considered is how well we're adhering to the governor's orders to stay home and save lives. What happens to the models if people stop adhering to those orders, and if people start going out and socializing in larger groups and congregating more and disrupting what we've been trying to build over the last couple of weeks? What does the modeling look like, or what is the overall sort of picture of COVID-19 in Oregon if we stop doing what we're doing?
Well, I will say right now the model shows that what we've been doing seems to be working, and that likely we've cut down transmission or infections in Oregon by 50 to 70%. But we need to keep doing those things. As you mentioned, if people start going back out and gathering, you know, meeting up and having a lot more contact with individuals, it's much more likely that they may transmit the infection to their friends, to their family members, to those they're hanging out with. As we learn more about this virus, we learn that there is more ability to transmit this virus before people get sick, and even some people who never develop symptoms may be able to spread this virus to others. The vast majority of the time people are most likely to transmit this virus to someone else is when they're sick, but that's not all the time. So if people start going out and gathering in groups and kind of acting the same way they did back in January before this came upon us, we would likely over the next week, 2 and 3 weeks, see a dramatic increase in those cases. And what that means is that more people are getting sick, more people may need care in the hospital and may need critical care, and that could put a great strain on our healthcare system, which right now is able to provide quality care that Oregonians, you know, deserve. But if we don't stay home to save lives, more people may get sick, and there may be more people seeking care than can get the care that they need.
I think that's a great way to kind of wrap up my questions. One more question for you. What's 1 or 2 things that you think hasn't been part of the conversation, that we haven't been able to get out to the public, or isn't something that we've been talking about when it comes to COVID-19? We've been talking flatten the curve, the importance of mitigating the potential surge issues. What's something that you think needs to be maybe a little bit higher on this level of conversation that we've been having?
Well, I think it's something that we had talked about a little earlier, the importance of, while we're staying home to save lives, making a difference in Oregon, that we need to remember to take care of ourselves. So as you said, you know, watching the news and keeping up with what's happening, you know, our media partners are a great source of information, but perhaps, you know, not having that on all the time. Knowing where to go for some credible sources of information, from our OHA website and the newsletter that goes out with the latest information on COVID-19 here in Oregon, to websites like the Centers for Disease Control and Prevention, some reputable sources. Some of the things that may be coming through on your social media feed, you know, just aren't true. And so, you know, knowing where you can go for information you can trust, so you can make the best decisions to care for yourself. And then taking those opportunities to take care of yourself. Again, you know, trying to eat healthy, trying to maintain the exercise routine you had, which it may look different, but getting some exercise, but really staying connected with your friends, family, and support system, because just because you're home and can't physically be with them doesn't mean that you can't be with them socially, that you can't, gather together in a group chat on your, camera with, 7, 8, 10 pictures on your laptop of your friends and gather together and share what happened that day or that week. Those are really important. We want people to maintain physical distance, but we also want them to stay connected in other ways to their usual friends and family and support system.
Physically distant, but socially connected. I think that's a really important takeaway from our conversation this afternoon. So thank you for that perspective and the continued reliance on credible sources of information so that we at the State Emergency Coordination Center can make the best decisions we can with the information we've got, and so that the folks throughout Oregon can make the best decisions for themselves and their families based on the information that we can provide. So thanks for joining us for my Q&A. I said emergency managers don't know everything. We certainly don't. I don't know how to be a journalist, so I'm going to stop trying to be a journalist right now and open it up to the real journalists that are keyed in to our webinar this afternoon and see what kind of questions we have for Dr. Sidelinger or for myself.
Jonathan from the Portland Business Journal, you have a question?
Hey, I've got a question for Dean. So obviously, nobody has a crystal ball. I'm sure a lot of people wish we did, but do you have a sense of what the likelihood of our having to, instate another stay-home order in like August or October or something like that, if we're not able to contain it in the first go, is that something that state officials have been sort of weighing or considering on your end?
Well, I think we're certainly planning for the short term, the medium term, and the longer term. We know that until we have a vaccination, the whole population is susceptible to this disease. It doesn't discriminate based on gender or age or where you're from. Anyone can get it. Most people will recover, but it will keep transmitting in our community until we have a vaccine that can protect people. What the models show is that at least through May, if we continue doing what we're doing and staying home to save lives, that we can prevent a rapid increase in cases here in Oregon and be able to provide the quality care people need. We look out beyond that, and some other modeling that has looked more long-term and some of the experiences from other countries who've experienced COVID-19 before us, and even from previous experience with pandemic flu in the past, we know that the disease can come back if we relax our community mitigation measures, if we go out and start joining again. So we want to make sure that we have some systems in place that we can manage the number of cases that may be presenting, that we have adequate testing, that someone could go to their provider when they're feeling sick, be tested, and then we could provide them the support and services they need to stay home while they recover. Because if those things aren't in place, you're right, we could see a resurgence in cases once we release some of these measures and then have to do this again. The actions we take have consequences, 2 and 3 weeks later, and we don't want to be in a position where we're reacting. We want to try and anticipate what's happening, and that's what we're doing in public health across the state of Oregon with our partners in emergency management to try and determine where we think we're going to be in a few weeks and provide that information to our decision makers so they can make the best decision possible to protect the health and safety of Oregonians, and also look at some of the longer term impacts that we know these measures are having so that we can try and build towards recovery.
Just as a quick follow-up, and then I'll yield. Andrew the other day had mentioned, this is like the first mile in a marathon. This could be several months or at least 2 months. Again, I know nobody has a crystal ball, but what are sort of the best case, worst case ends of these stay-at-home measures in terms of how long they would last? And obviously, the intent here is to keep everybody as safe as possible. But what is the best case, worst case?
And Dean, could you repeat the question just to make sure everybody hears it?
Okay, so kind of not having a crystal ball, but looking forward, what do we think is best case, worst case scenario for kind of relieving some of these measures so that people can start to go out and do some of the things they did beforehand? And I will say, the longer these measures are in place, we definitely know that if people are adhering to them, listening to them, that they're going to prevent the spread. But we know that that has a great cost. to our economy, to individuals' ability to earn a living in many cases. And so we want to be at a place where we can thoughtfully and safely recommend to our policymakers and work together to come out of this. I think that's, not days away, not even a couple of weeks away, but we're probably looking at the month horizon at least to really consider next steps and changing things. But that's why we continue to look at the data as it comes in, use that data with our modelers and our research partners to say, okay, can we refine this? Can we feel better about what it's going to look like in 4 weeks and 6 weeks so that we can make recommendations to safely kind of change some of the things that are in place right now. But this is, as you quoted Andrew, this is the beginning of a marathon, not a sprint. So, this is definitely something we're probably going to have to address for the weeks to come.
Amy Breen, you have a question?
Hi, yes, Dr. Sidelinger. I have 2 questions for you. The first part of it is about what advice would you offer to people who are trying to socialize at a distance? For example, I've seen neighbors sitting more than 6 feet apart in lawn chairs in their driveways, friends trying to have picnics in the park at a distance, or friends running together, but they keep a distance from each other. Do you think that that's okay?
I think, it's not that we don't want anyone to, say hi to your friends or have a conversation with your friends. Definitely trying to stay 6 feet apart. If you're out there, sitting on your front porch, talking to your neighbors is great. If you're running or biking, not doing it, side by side, but keeping a little bit of a distance so you still have that connection, but maybe aren't as close as you usually were. That's why I think the idea of virtual gatherings, rather than kind of going out into the park and sitting around in a circle even 6 feet apart, are probably the better way to go. So you're not tempted, you're not getting closer to people, but you're really limiting your contact with others. So, going out for a run or a bike ride, walking your dog is certainly something that we should all consider doing, if we can stay 6 feet apart from others. But otherwise, if we want to get together with our friends, pull them up on a video chat, move all the circles where you want, sit next to who you want on your computer screen, and eat dinner or have a drink and have a conversation and catch up on what happened that week is probably the safest way to go. Doing that physically distant from them in your home, and it's a lot easier to get ready for that than going out in public.
I've also been curious about, I've seen a lot of people on the hiking trails in Portland when the weather's nicer, and they are spaced apart, but there's a lot of passing of people going in opposite directions. So on a crowded day, I don't know, if you walk a mile, you might pass a couple dozen people walking the opposite direction of you, and it's impossible on a trail to get more than 6 feet apart. Is that something people should be concerned about?
I definitely think there should be some concern there. And that's why you've seen in Oregon that Governor Brown has issued these executive orders very thoughtfully, starting with orders and recommendations for people so they could take steps to help protect themselves. And when those steps maybe weren't having as much of an effect as we'd hoped, to put additional things in place. And that's why with one of the most recent executive orders that shut down some of our outdoor spaces and really encouraged more people to work at home and required some businesses who couldn't offer physical separation at work to close, because we wanted to remove some of that temptation. We wanted to remove some of those scenes we saw people gathering together on a beautiful day in Portland, because we know, at this time of the year, we relish being out there in the sun. But, this is the year that we're going to have to take off, greeting some of those, late winter, early spring sunny days and just look at them from our window, our balcony, our front porch, rather than going out and enjoying some of the great open spaces. When we're not seeing the level of transmission in our community and we're able to kind of go back to normal, let's relish those times this summer and fall when we can get back out and do some of those things more safely.
Thank you.
Elizabeth Jones, do you have a question? Elizabeth Jones, you are self-muted. Okay, let's go to Dick Hughes.
I have a couple of questions, and the first one, I apologize if it seems simplistic. It's a semantics question. I don't understand how someone could have the virus but not be considered sick. I understand how they could be symptom-free, but as I write, I'm trying to figure out how to describe someone being sick, not being sick, but being able to infect someone else. So is it accurate to say they're not sick, or should we say they don't have symptoms?
I think we could take that a couple of ways. You could say they are infected with the virus, but they don't have symptoms. You could say they're infected with the virus, but they're not sick, because to me, sick is kind of how they're feeling, how their body reacts to it. So I would go with one of those two ways. They are infected with the coronavirus that causes COVID-19, but they're not showing any symptoms. Or they're infected with the virus that causes COVID-19, but they're not feeling sick, or they're not sick. And I would go with one of those two ways.
Thank you. My second question, and you sort of responded in your opening remarks, but I'd like to ask more specifically. I just got the OHA press release announcing 90 new cases today. What should we make of the fact that there were 90 new cases today?
I think, what we've seen over the last several weeks is that while that testing capacity may not be where everyone would like it, we are seeing increases overall in testing capacity week to week. As we test more individuals, we're going to identify more people who test positive. And so I think those numbers, we continue to watch them daily. I think those numbers will stay up for a little while before we actually see them come down. The test results that are coming back today are results of people who may have been exposed to someone 2, even 3 weeks ago. So it's going to take some time for our social distancing measures to really show up in those daily counts. And as the testing numbers go up, those daily counts may continue to go up, which is why it's important for our modelers to try and determine how much disease is there in the community, regardless of who's getting tested. And that's why using a lot of information, feeding it into the program to see where we are is giving us a better tool for planning than just relying on our current daily case counts.
Thank you.
You're welcome.
Okay, Angie Butler, you have a question?
Yeah, I was just wondering if you're going to be able to come up with a test that will determine if we've had the virus in the past.
I think there's currently many companies, academic institutions out there developing what we would call a serology test. And that would be a test, typically draw some blood, and we can see if that blood has antibodies to this particular infection in it. And that would be an indication that someone either currently is sick with the virus or has recovered from the virus. And so those tests, have been available in some other countries, and we know there are companies in the United States working on those tests to get them approved. And I would anticipate over the next month, we'll see availability of those tests that will complement the current tests we have that look for the virus itself.
Okay, thank you.
Okay. Lisa, Bailey, do you have a question?
Lisa Balick from Coin Channel 6. Can you hear me all right?
Yes. Yep.
A question for Dr. Sidelinger is, why are we still seeing a higher number of cases in Marion County compared to most other larger counties? What are the possible reasons, and will that likely change soon?
I think, the virus certainly transmits from person to person. So as we identify cases in a community, it is likely that we're going to see increased cases in that community. For those who've been following this, which most of you have, we had increased cases in Washington County early on in this outbreak, and now we're seeing increased cases in Marion County. Some of that is the normal transmission of the virus from person to person, and also as testing becomes more available, we will identify more of those. So that's why it's very important that public health, our local public health partners are still on the ground, looking at those cases, doing investigations to assure that folks who were exposed particularly in congregate settings, our healthcare workers or those most at risk for the disease that we follow up and try and give them some ideas of what they can do to help protect themselves, or see if we need to do some additional testing because people may already be sick. So I think we'll continue to see different parts of our state that have increased numbers, and we continue to work with our local public health authority partners to investigate and see what might be causing that. But I don't have a great answer of what's going on behind those numbers, the same way we didn't when we saw those in Washington County earlier.
Is it perhaps because they had one of the earliest cases identified and may have spread a lot quicker before those contacts were identified, such as in Washington County as well, having the first case?
I think, what we know from our early cases here in Oregon is that they weren't linked directly to travel from another country or exposure to an infected individual. Many of our early cases were based on what we call community spread, meaning we don't know where they got it. And so that indicates that it had been circulating in the state of Oregon before we picked up that first case. And so, yes, I mean, that is possible that it's spreading in that community, but I think, it's probably spreading throughout most communities here in Oregon, even if we haven't identified a positive case. And that's why the orders to stay home to save lives and the other recommendations we've had from the start, which are good old-fashioned public health of washing your hands and not touching your face and wiping down surfaces, are some of the best ways we have to protect ourselves.
And Dr. Sidelinger and Lisa, just to add to that, again, that's why we need to continue to emphasize the physical distancing piece of this. It's really important that we don't necessarily know who may have been exposed and who those people might continue to expose. So staying home is really a great way to limit the further spread in communities. And again, it's not just in those really urban areas like Portland or Salem. This is becoming an issue across the state. Our rural counties, the super rural areas in southern, central, and eastern Oregon. This is really going to have a big impact if we can continue to stay home.
Claire, you have a question regarding PPE.
I do. I actually have two questions. My first question is, at this juncture, if you're able to say, how long do you expect the current supply of personal protective equipment to last?
Claire, I'll take that one. The question is, how long do we expect the current supply to last? At this point, it's really going to vary, I think, from county to county and maybe even facility to facility. One of the things that we're working with our county emergency managers on is to do what we're calling burn rate tracking, how quickly they think that they're going to use their PPE given both the current scenario and what the trends are telling us they might need. So as I've said a couple of times this week already, we're trying to fill our warehouse in Wilsonville as quickly as we can with as much certified PPE as possible. But really the importance of flattening that curve and reducing exposures or potential exposures to our first responders, our hospital workers, our doctors, our nurses, that's going to also help to extend the limited stock that we have. So I can't put a point on it and say, yep, on this date, we're going to run out of PPE, because we keep having injects into our system, our supply chain. Individual providers keep receiving donations and trying to do procurement. So there's a lot of material coming into the supply chain, but it's going out just as quick as it's coming in. So that's job number one for us, is making sure that we have that supply chain established. We're continuing to work to establish it, getting supplies from the feds, from private sector entities through procurement, et cetera, just to make sure that we don't have that clock that says at this time on this day we're going to run out. It's something that we're assuming is going to happen at some point if we don't make our supply chain more robust.
Okay. My second question is, I have heard from workers in various settings that they are concerned that while their businesses remain open, that they are not adequately protected from the virus because they don't have gloves, they don't have masks, things of that nature, particularly for grocery workers and for those workers whose businesses haven't closed. I'm wondering if you foresee at any point those, non-healthcare but still kind of essential workers will have access to protective equipment, and when that might be. And if not, you could see stricter measures about which businesses are open or how many workers are at a business at a given time being undertaken?
Yeah, so we're working with our counties on that recommended methodology for how they're distributing their PPE. Right now, the focus remains on those frontline healthcare workers. If we can't protect those folks, the situation is just going to become much more exacerbated much quicker. We're going to have more people that need treatment and fewer doctors and nurses and frontline medical workers to treat those people that are getting sick. My hope is, I think one of the reasons we're working so hard on this is because we want to make sure that anyone that might have a potential exposure through the critical work that they're performing has what they need to protect themselves. I see a lot of really kind of innovative things happening, especially at grocery stores where they're doing measures to increase the ability to do social distancing. They're doing much more frequent cleanings of the checkout stands and the aisles and the door handles. Some grocery stores are limiting occupancy to very small numbers to allow people to spread out a little bit more through the store. Most grocery stores in particular have limited their hours. They've created hours specifically for folks that are in those higher risk populations, which is fantastic. But again, it comes back to not going out unless you absolutely have to go out. Trying to buy groceries for a week or two at a time so that you're not in the grocery stores more than you have to be. I understand that's not a reality for some folks. A lot of people don't have the ability to do that, and they have to go grocery shopping when they have to go grocery shopping. So those of us that can prepare a little bit better for this, those of us that can stay home a little bit longer, please do so. It's going to provide a little bit more space for those folks that have to be out in the communities serving Oregonians.
And I just want to build on that a little bit. I think, Andrew mentioned some of the things that stores are doing. I think probably all of us have had the experience now of lining up several feet behind someone in front of them outside a grocery store, waiting to go in so they can limit the numbers and increasing the cleaning. But as individuals, we can all help there. So if there's multiple people in your house, just send one person to the grocery store, one person to the pharmacy. Make sure that they're not sick themselves. When they get there, maintaining that distance from others. If you have the ability to do contactless payments or another method where you're not handing cash or cards to the grocery clerk, that can help as well. So, we can all take some steps, even when we have to go out, to help protect those essential workers in the grocery store and the pharmacy, just like we hope our grocery store, and we know our grocery store and pharmacy partners are taking to help protect their staff.
Rob Davis, you have a question?
Can you hear me? Can you hear me?
Hey, Rob, yeah, a little quiet.
I wanted to know how reliable Dean thinks the IHME model is compared to the work the Institute for Disease Modeling has done.
I believe the question was
if we could repeat the question. Yeah, thank you.
How reliable we think the Institute for Disease Modeling model versus the IHME model, both of which come out of the state of Washington. I think they both have their merits, and they both provide us information and planning to look forward. The IHME model is kind of a little more simplistic in the way it does its modeling, in taking the numbers, the cases that we're seeing now, and kind of modeling forward based on what that's happening. What we like here in Oregon about the Institute for Disease Modeling is that their model takes into account some of the social distancing measures that are in place and can adjust those based on, so what do we know about how this disease has behaved in other countries and communities? How likely is it that someone could infect someone else? And then how likely are the interventions we have in place to reduce those contacts and thus reduce transmission? When we reduce transmission, less people are sick, less people present for care. So this model, we are able to put Oregon-specific information into it from our daily case counts and what's happening on the ground, model the broader picture of what's happening in the community and project forward. All models inherently will have some error in them, will have some uncertainty, particularly the farther we go out. So while we, have been using and pushed the Institute for Disease Modeling update out this week from the report we had last week, we also look at some of these other models, look at what are some of the strengths or weaknesses in them, and take those into account as we plan, as we make recommendations to our decision makers, so we can try and present the best picture we can. So I think, to sum it up, I think our Institute for Disease Modeling really takes into account the picture on the ground here in Oregon, the measures we took in place, and gives us some confidence in what it says going forward. The IHME model also, has information about our case counts, but offers kind of a broader, kind of more blunt picture of what's happening here in Oregon as it does in other states.
Donald Ford, you have a question?
Howdy, can you hear me okay?
Yes.
Awesome. One main thing I wanted to ask Andrew was, have there been any updates regarding the amount of PPE the state has received from FEMA at that Wilsonville distribution center? Do you have a final tally of that at all?
Thank you for that question. The question was, do we have a final tally of the amount that we've received from the most recent push from the Federal Emergency Management Agency? I don't have those numbers in front of me. I know that there was a shipment received within the last 24 to 48 hours, and more is en route to Oregon. But if you can reach out to the Joint Information Center, they'll be able to provide the most current numbers on that.
Thank you. And I think this was asked earlier. This is another question for Dean Sidelinger. Have you talked about specific blood tests for people who have recovered in regards to immunity and sort of tracking that as well?
So the question was about specific blood tests for immunity, and we touched on that earlier. We know that those are being developed and likely will be available to our clinicians and folks in the community in the next month. That will help to fill in some of the gaps because a blood test can help identify those who may have already been infected and recovered and can help them make decisions as they go forward. So yeah, we look forward to having those tests available the same way we look forward to having additional COVID-19 tests available so that can paint a broader picture of what's going on in Oregon.
Cool. One last one for you. You mentioned earlier that emergency rooms are seeing sort of a drop-off since folks are staying home. Is there any news regarding hospital workers sort of shifting gears toward ICU units that are focused on COVID, or have there been any layoffs in regards to hospital workers that are normally in the ER?
So let me say that I know the measures we've taken for social distancing, community mitigation have been hard on many businesses, and our healthcare businesses are included there. They've canceled elective surgeries, non-urgent visits. Many of the primary care and preventive visits that we're used to going to make sure that we're healthy have been canceled. So we know there's been an economic impact on our hospitals, and particularly some of our rural hospitals may have been more impacted. What we do know is that as our hospital systems plan and implement changes to care for COVID-19 patients and potentially more COVID-19 patients, that they are shifting some of those folks who may have been doing outpatient care. And now that they're doing those visits via telephone and telemedicine, that some of those individuals may be available to shift to urgent care visits or emergency department visits. And that some of the folks who typically take care of folks on a regular hospital floor may be training up to take care of intensive care unit patients as part of a team method so that they can kind of use their staff to provide the highest level of care that they need to and pair them up differently than they have in the past. Trying to separate folks in the hospital who may be immunosuppressed and may be more susceptible to infections in one part of the hospital from those who are coming in with COVID-19 so that they're not likely to get infected. And so our healthcare partners have been taking those steps and continue taking those steps, and we're working with them together to ensure that we have that capacity across the state when and if we do see a significant surge in cases.
Awesome, thank you so much.
We have time for one more question. Lachey Wesley.
So my question was about the testing, and part of what the modeling that came out yesterday discussed is for the state to have the ability to test, track, and trace. Is the state going to have the ability to do that, and at what point?
Thank you for that question. I think that is something that we are looking forward to having, and I think by having an arsenal of different types of tests available and more tests available, we'll be able to do that. Right now, we know that the turnaround time for test results at some labs, extends not just several days, but more than a week. And that's very difficult for someone to make a decision, for a provider to make a decision about the patient who's in front of them and what to do next. So we know that some additional rapid tests are becoming available. As capacity increases in labs, the materials are there to do the test, that we will see those results come back more rapidly so that providers and public health can provide that information to individuals so that they know the importance of them staying home while they're sick. Right now, everyone should be staying home, but this is looking out into the future when we're able to lift some of those orders. So if we know that using the measures we have in place now, that we can slow the spread of the disease throughout our community as these additional tests become available, the blood tests that show people who were infected in the past and aren't infected now, that we'll be able to partner better, our healthcare providers, our public health staff, and partners, to make sure that those who are sick, that they stay home, that we can get the services, the supplies and things that they need to stay home and check up on them regularly so they're not out in the community infecting others, as we one day hope to lift these measures and let people go out back to work and some sense of normalcy again. But again, that point is weeks, if not more than a month in the future. But that's those are some of the tools that we're looking at and hoping to have in place when that happens, so that we can better control the spread of this disease.
Dr. Sidelinger, thank you so much for making yourself available today to answer some of these questions. We appreciate that information. We hope you'll be able to join us again sometime in the future. To all of you, thank you for spending some time with us. If we didn't get to your questions, make sure you reach out to the Joint Information Center and we'll get responses to you as quickly as we possibly can. As we close, I want to encourage Oregonians, do something to take your mind off of what we're dealing with today. Reach out to a friend, a neighbor, a family member. Take some time to take care of yourself. And above all else, stay home and save lives.